Cancer patients are now fighting for more than just their lives. They're battling to get their medicine. And a big part of the problem is many of the tried and true chemo drugs are just not profitable.
I think the hardest thing about it all was when I had to tell my kids.
It was tough enough for Kathy Mormon to reveal to her family that she was diagnosed with stage 4 colon cancer, which had spread to her liver. Now this mother of 2 from Ypsilanti is facing an even scarier battle. Mormon recently found out her life-saving chemotherapy medication soon may not be available.
And that was pretty devastating because the drugs have been working. My tumors in my liver have been shrinking.
Mormon says after the nurse at her chemotherapy center told her about the national shortage of several cancer drugs, she started doing some research online, and she was shocked. According to the Food and Drug Administration, 199 drugs are currently in short supply. 16 of those are used to treat cancer.
I was very discouraged to think that something like that could happen in this day and age.
Captain Valerie Jensen is the Associate Director for the FDA's Drug Shortage Program.
There's no requirement that companies let us know about a shortage for the most part, so that's been a problem.
Another problem? Captain Jensen says FDA inspections have turned up quality issues with several of the companies that make chemo drugs. When a production line shuts down, it has a ripple effect on supplies across the country. Some manufacturers are having trouble getting raw materials, but for other companies, it's a business decision to stop making older, generic, injectable chemo drugs.
These drugs are not making as much money as a newer agent, and so unfortunately we see fewer firms making them.
Drugs like Doxil for breast cancer and leukemia, 5-FU for colon cancer, and cytarabine to treat leukemia are all in short supply.
You have people who have acute leukemia, especially children, where we can cure 70 to 80% of the children, and the 2 drugs we use are both in short supply and on the shortage list. That seems completely unacceptable to me.
Former White House advisor Dr. Ezekiel Emanuel is an oncologist and medical ethics professor at the University of Pennsylvania. Dr. Emanuel told us via Skype that the U.S. needs to allow generic chemo drug prices to rise so companies will continue to make them.
They're relatively easy to manufacture. We've been doing it for years, and the fact that they're so cheap provides little incentive to produce them, even though they're life-saving. And that, I think, is a tragedy.
They're playing with people's lives, and that's just not right.
And what's worse, there is no quick fix. Congress is looking at legislation that would require manufacturers to alert the FDA if they're going to stop making a drug or if a shortage is on the horizon. Other solutions being discussed at the national level include creating a government stockpile of chemo drugs in case of severe shortages, and the FDA has been working with overseas suppliers to get more medications.
For those of us who are involved in healthcare, it's a constant battle.
Stephen Smith is the Director of Pharmacy Services for Karmanos Cancer Center. Smith says his staff is constantly monitoring websites to find out which cancer drugs are in short supply, and then they alert the doctors immediately.
We identify patients who are currently on that therapy to make sure that we have enough drug to complete those patients' therapies. And then as new patients come in, we work with them to make sure that we have enough drug.
Karmanos won't start a patient on a chemo drug if Smith and his team can't set aside enough of the medication before therapy starts.
Switching horses in the middle of treatment is difficult, and it may not provide the patient with the very best care.
If Kathy Mormon's doctor can't find her chemo medication for her remaining treatments, she could take a different drug, but not without some serious side effects. What she really wants is for Congress and the drug companies to fix this problem before it's too late.
I guess I would say to anybody that's in this decision-making process within the drug companies, what if it was your family member? What if it was you? What would you do then?
The FDA will soon be releasing a report with recommendations on how to fix this national problem, and we've learned a congressional hearing on this issue is scheduled for next week. Doctors don't want patients to panic. They say the most important thing you can do is communicate with your physician about your care. We have much more information about this important issue on our website, WXYZ.com. I'm Heather Catallo, Channel 7 Action News.
Certainly a scary thought for so many people. Thank you much, Heather. Now, industry experts also want the FDA to speed up up its turnaround time for getting other manufacturers approved to produce chemo drugs. FDA officials say they are already trying to make sure any production lines that get shut down due to quality issues get back up and running as quickly as possible.
And we're just checking, the FDA is holding a public hearing on drug shortages on September 26th. Of course, we'll be watching and let you know how that one plays out.